Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness and is brought to you by Freedom from Addiction.
Welcome to Living Clean, Living Well, everyone. I'm your host, Teresa Kruze, and tonight we welcome my two guests, Dr. Vera Tarman, who is the Medical Director at Renaissance, and Addictions Counselor Donna Sadler. Glad to have you with me tonight, ladies. Tonight, as part of the We've Been Listening to You series, we're going to be talking about trauma and addiction, finding peace and recovery. So Dr. Tarman and Donna Sadler are here to help you in any way that they can. And of course, our phone lines will always be open to any general questions that you may have about addictions and substance abuse. But today is a very special day, and we would be very remiss if we didn't say and give a big shout out to all of our moms that are watching tonight. I'd like to say Happy Mother's Day to my mom, who's watching in Calgary, mwah, and to my mother-in-law, who's watching from Toronto, mwah, and to all of the moms that are very near and dear to our hearts, and to all of you, I say Happy Mother's Day. Dr. Tarman?
Well, I'd like to say Happy Mother's Day to all of my patients who are moms. So Happy Mother's Day.
And Donna, how about you? You're a mom, aren't you?
I am a mom, so I'd like to thank all my kids for making me a mom and say Happy Mother's Day, Mom, to you. Love you very much.
Oh, that's awesome. So, with that, let's start in on the show. Trauma and addiction. You know, I've been hearing the phone calls that have been coming in now for the past couple of weeks, even a past couple of months, I must say. And it's a lot of people are saying, you know, they're dealing with the trauma that's happened in their past, and they're having problems moving forward. Or perhaps the demons from the past are coming back to visit. So it's affecting the recovery. So I thought we should do a show on that. Before we get going, I would like to talk to Donna about her background. We have brought her in especially for this particular show. Donna, why don't you tell people a little bit about yourself so that they can understand where you're coming from and where you've been?
Okay, thanks, Teresa. Well, I've been working in Toronto in addictions, mostly with women for about 10 years. And I do have some personal family history of addictions and mental health issues. So that was really what got me into the field, and yeah.
So you're a counselor now?
I'm an addictions counselor, yes.
Wonderful. And you do help people that have had past trauma, right?
Yes, I've done a lot of that work with the patients and the clients that I've had.
And Dr. Tarman, in your practice with the work that you do at Renaissance, what percentage would you say are we looking at here as far as your patients, and who's dealing with, like what's the percentage in those that have dealt with trauma that are also having to deal with addictions? Yeah,
well, when I worked in two major centers. I worked for Renaissance and I worked for Homestead. And so it's two kind of separate clientele. And I would say that probably about 30 to 40% have some kind of trauma background. And if I were to expand that to, I mean, if we're talking about trauma like sexual abuse or domestic violence.
Even verbal abuse.
But if
neglect?
If we expand it to, like oftentimes people have a family history of alcohol, like drug addiction or family history of alcoholism. And if you look at that and look at all of the types of abuse that occur with that, like neglect and verbal abuse, physical abuse, I think we could look at more than 50%. So it's very, very common, and it's frequently a reason for people using, because they're trying to self-medicate. They don't know how to deal with these emotions, and so they're using alcohol or drugs to get through.
But Donna, you and I were talking before the show, and you were expressing why that isn't a good idea, and that the other things that it manifests into. Would you like to explain about that?
Sure. So, you know, as an addiction therapist, I may think of a person's substance abuse as the problem, but for them, very often, if they have a trauma background, they're thinking that the substance use is helping them. The substance is maybe for them the solution to the problem, but it really isn't, because you know, as we all know, I think using or misusing a substance can put you in a greater risk. You know, you can be at risk of incurring more trauma in your life. You know, you could get in a car accident if you're driving your car while you're under the influence. You could make some poor choices about where you're going and who you're going with. You know, even the fact of even falling down the stairs, for example, right?
Good point.
So definitely using a substance to deal with
Just puts you at more risk for further trauma.
more risk for further trauma,
Yeah.
yeah, and then more of those unstable emotions that are very hard to handle, and maybe more risk of using more.
Yeah, yeah.
Because after a while, it doesn't work as well, and you've got to up your usage, right?
Yeah.
Or what happens is you never actually deal with it because the substance is sort of blottoing out any possibility to process.
Right.
I mean, time can do a great deal of healing, but it won't. I mean, what drugs and alcohol do is it kind of freezes you at that spot, and you never get past that. And then it does just get worse.
Yeah.
Yeah.
So, as a medical doctor, how would you best go about if someone comes to you presenting that they're battling an addiction, and it is stemming from trauma that they have had? What's a course of action? What would you suggest to them?
This is where there's a really big debate. And I don't know where you stand in this, Donna, so maybe you can elaborate yours. But from my perspective, and I can't say it's the only perspective, it isn't, but it's my perspective, is that if a person is using that, they have to stop using first. But I know that other people don't. They think you should try to do both at the same time. But in my experience, if the person doesn't stop using, they're not able to process or deal. I mean, they're not able to process anything, and then they don't get any further. But anyway, so I don't know, Donna, how do you feel about that?
Well, I guess the other side of that coin is when we're talking about trauma symptoms, you take away that substance that has been kind of keeping the trauma symptoms, which is like nightmares, serious problems with sleeping, maybe not being able to connect to people, or feeling too much, feeling too emotional all the time. If the substance is helping you deal with those things and then you take it away, those feelings, those issues are going to be back 100%. And that just puts the person in risk of relapse, because that might be the only thing they know how to deal with. Alcohol is what gets them to sleep at night. Or,
I think that I don't work in these centers, but the places where they do that, where they try to work both with the trauma symptoms and the addiction, tend to be longer term places where you actually have the time and the containment, because it's not, you stop using a substance and the symptoms come back, and then you're out in 3 weeks. That's not good. But if you actually have like the luxury of a 6-month program or a year program, then you actually can do some work while the person is in the contained safety of the treatment center.
Tonight we're talking to Dr. Vera Tarman, who is the medical director at Renascent. We're also talking to Donna Sadler, who is an addictions counselor. And we are talking about trauma and addiction, finding peace and recovery. Let's go to our toll-free lines right now. We're going to go to line 4. Kim's calling in tonight from London. Hello there, Kim. You're live on our show. Go ahead.
Hi. I would just like to say that I quit smoking cigarettes. It was 7 weeks this past Wednesday.
Good for you.
Tomorrow night will be 4 weeks that I quit using marijuana. And what my question is I do attend church faithfully. Sometimes, like most times, it's 3 times a week, a small group, and then I usually go twice on Sundays. And I have a very personal relationship with Christ. But my question is, since I have quit using, and actually you were just discussing this, my family and I have been through a tremendous amount of trauma. My daughter and I, a lot of sexual abuse. We actually put my ex away for 14 and a half years, and then she was taken by 2 men from a library out of the city. We didn't know where she was for like 4 or 5 hours. She got away. And then we just found out not too long ago that my dad had been abusing her all her life. And once he was arrested, we were disowned by my mom and my sister. And we've done a lot of discussing, so it's triggered a lot of my own stuff.
Sure.
I have felt so much emotional pain. And is it very normal? Like I've been using, when I was using, it was for over 10 years, quite a bit, like quite a few times throughout the day. And is it normal to feel this amount of like tremendous pain? Like last night, it was almost to the point, like it was too much for me to bear.
Wow.
But I didn't use. I didn't go out and buy a
for
pack of
you.
soaps. I actually called my pastor and I cried like I've never cried before.
Right.
A lot of people that know my story, and there's not enough time for me to get into it, have recommended that I go away to a trauma-based treatment center, and I actually feel like I need that. But what my question is it normal in like the physiological part of your brain? Like, is that normal to feel this much pain?
Well,
Okay, before we get into it with our panelists right now, Kim, you said last night that you almost had too much pain, more than you could bear. How are you feeling right now, Kim? Are you stronger tonight?
Today, I think, was a good distraction because of Mother's Day.
Yeah.
I went to church, and Pastor Rose was surprised that I even attended. But, and then I spent some time with my kids.
That's good. Kim, I'm going to let Dr. Tarman and Donna talk to you right now, and then at the end, I'm going to give you a resource, okay? So Kim, hang on. Let's hear what Dr. Tarman and also Donna have to say. Go ahead.
Well, Kim, first of all, I'm very impressed that you were able to stop smoking both cigarettes and also marijuana, 4 weeks ago and 7 weeks ago. And even if you didn't have the history that you're talking about, oh my God, you've just effectively taken two of the ways that you've managed or suppressed your emotions, and now you're feeling these emotions fresh. And that's even without the history that you've just told me or told us. Of course, that's exactly what's going to happen. You're going to be overcome with emotion. People, when they stop using, what you're talking about is exactly what they say. It's like, I had no idea that emotions could be this powerful. But then you're talking about the history that you have with all of that stuff, all of that abuse. I mean, even without drug use, like putting those two together, I'm really quite impressed that you're sounding as well as you do. I'm really glad that you have your church support. And I mean, I hope, Donna, you can tell her about some other supports. There are other supports out there. Please access them. What you're feeling is totally normal. And there is help for exactly your scenario.
Go ahead, Donna.
Kim, I just want to say that's really good what you did last night when you were feeling so bad and you reached out and you phoned somebody and you talked about it. And that's really what stabilization from trauma and addiction is about, is finding other ways to take care of yourself when you're feeling like that, other than using. And so you did that last night, so that's excellent.
Resources, Donna?
The Center for Addiction and Mental Health is here in Toronto. I see you're calling from London, and I'm not really aware of a lot of the resources there. The Center for Addiction and Mental Health is always a good place to start. If you have access to the internet, they have a great website that's easy to move around in, and you can find out more about some of the programs they offer and maybe what's in your area too. I'm just sorry I don't know, what's available in your area right now, but it sounds like you've got a good support already through your church and your pastor, and I think that that's great. Hospitals often have an outpatient clinic, mental health, sometimes addictions, but you would just have to phone your local hospital probably, and they could help you find the right department, because they very often have outpatient clinics that work with people like yourself that are looking for some kind of support.
There's also a call or look up on the internet, 211.ca, and you can find resources that way. You just got to get one person in the system who can then direct you further. And also, don't forget 12-step programs. There's NA, Narcotics Anonymous, which marijuana would fit in, and that's another whole support system along with your church. But you did. I concur with Donna that calling support is exactly what you should be doing. You're calling us now. This is great.
Yeah, thank you so much. That is great insights for you, some great resources. And I'd also like to say to you, Kim, the Canadian Centre for Abuse Awareness would be a good resource for you as well. We will put the telephone number up on the screen for you. You can give them a call, and perhaps maybe they can also head you off in the right direction that could help you and your daughter. So, Kim, thank you so much for reaching out tonight. I'm glad that you're feeling stronger. And please remember that, when you're really deep and low, and you said it was almost too much to bear, please reach out, like Donna said, to your hospital. reach out to your healthcare providers, reach out to a crisis line, okay? So, Kim, thank you so much for calling in tonight. We're going to take our first break here on the show, but when we come back, more from our panelists and more from you.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Welcome back to Living Clean, Living Well, everyone. Tonight we're talking about trauma and addiction, finding peace and recovery. We'll also take your general questions as well. My guest, Dr. Vera Tarman, who is the medical director at Renascent, and also Donna Sadler, who is an addictions counselor, but she has also worked with many people in the area of trauma. I wanted to mention that before we get back to our phone calls, we've had a lot of people reach out to us, and we are going to be doing a lot more in this area. Earlier this week, we had a lovely message on Facebook that I would love to share with you. It's from a viewer. I don't want to mention her name. I'll just say she has an initial I in her name. And she wrote, our viewer says, I am learning every day that courage is opening up to vulnerability in spite of my fears. It is only by learning to listen to the little girl inside that I can begin to heal. I have spent so much time and energy trying to escape the only person who held the answer to my restlessness, myself. I have removed my mask. I am purging my lies. I am unleashing my wounds, and I am finally detoxifying my past. I am finding home, not in a new city, but within. I love your show, a huge part of my toolkit. And last week we were talking about the tools in the toolkit. And I just wanted to say to this viewer, thank you so much for reaching out to us on Facebook. And folks, if you would like to say something to us, maybe you have an idea for a topic on the show, because I always keep my ears out. I try to listen for themes. And this is what brought us to tonight's show, because I was hearing a lot of you in the pain that a lot of you were calling in and wanting to talk about. So that's why we're talking about trauma and addiction tonight. But if you have some ideas for a show, perhaps there's something that you would like to have dealt with, or maybe you'd just like to give us your comments about this show, or perhaps maybe your journey through recovery, look us up on Facebook. It's Living Clean, Living Well. Leave us a message. We'd love to hear from you. So let's go back to our phone line, shall we, ladies? Dr. Tarman and Donna are in the house. Let's go down to line 2, and Sherry's on hold from Scarborough. Hi there, Sherry. Have you got a comment or a question for us tonight?
Yes, I do. I would just like to say Happy Mother's Day to all of you.
Aw, thank you.
I do have a question. I've been living with trauma for most of my life, from the age of 5 up to the age of 18, but also past that in my addiction part of my life. I've been using alcohol and drugs since I was the age of 18 and on, and I've just stopped. I'm almost 10 months clean and sober. I was wondering how I go about dealing with the trauma now that I've stopped using drugs and that.
Excellent question. Who would like to start?
Well, let me just say, first of all, thank you for calling in. And my first bit is don't try to deal with this on your own. Trauma is something that should be best done with another person, a counselor, or in a group setting, but don't try to do it on your own.
Sherry, I just was wondering how it's affecting you now that you're not using.
I do deal with depression and anxiety.
Yeah.
I've just recently graduated from Homestead, the day program, and that's something that I've been wanting to deal with now. So it's really difficult for me now. I do have dreams, like flashbacks and things like that. So, and it's really starting to bother me with my depression and anxiety.
Donna, you were talking about that earlier in the show.
Yeah. Well, I think, again, that you could contact a number of hospitals in Toronto, if that's where you're living, and they might be able to point you in the direction of a program. I know of a number of programs that would be appropriate, I think, for you to investigate.
Like that RAP program.
The RAP program at Women's College Hospital.
So RAP, how do you spell that? R-A-P or
WRAP.
W-R-A-P.
Yeah.
What does that stand for? Do we know? That's okay if we don't.
I forget.
Yeah, that's all right.
Women's resource abuse. I'm not sure.
Yeah.
And then what about that Divine Divas? Isn't that something as well?
Divine Divas is a great group for more informal. It's a drop-in group that you can go to. It's at Toronto Western Hospital. Yeah, I think it's Wednesday afternoon. So if you have that time free, that might be something that's really easy to access. There wouldn't be a waiting list, I don't imagine. And it's a
Can
nice.
you find them through the internet?
Yeah, 211 Toronto would be a great way to start. And calling the individual hospitals, Women's College Hospital and Toronto Western Hospital would also be a way that you could access those numbers.
The other thing is, this is something that I'm always very concerned about, especially in new recovery, which you are at just at 10 months, is it's really important to, before you dig deep into the abuse issues, I mean, if you can't do the suggestions that we've just made, but there's other things that are also available, like the mindfulness meditation programs and cognitive therapy programs, also in the hospitals. Almost all of the hospitals have these now, and these are tools that, like, it's essentially building your toolkit so that you have those available and accessible for when you do finally find some place that you can work on your abuse issues. And by the way, also Jean Tweed has an abuse program.
Jean Tweed does have a good.
And I think they even have an outpatient, like a day program.
Yeah.
Yeah. But I would really encourage you to build your tools, get your supports, like if it's not church, then a 12-step program, something, so that you're not on your own in the middle of the night when your therapy's over.
And Sherry, if I could just add, did you say you had just finished a day treatment program?
Yes, I did. I just finished again, actually.
Yeah. So that might be a good way for you to, if you stay in touch with your supports that you have at that treatment program, they could probably help you to decide what would be a next step for you.
Yeah, like the counselor can probably help you. And the alumni group is another support.
Yeah. And I think it's really important that you continue to do the things that you're doing now, even when you start something new.
Okay, thank you so much for that, Sherry. I really hope that that's helpful. Let's go now to line 3, and Sonia's holding on tonight from London. Hi, Sonia. You're live on Living Clean, Living Well, and you're talking to Dr. Tarman and Donna. Go ahead.
Hi.
Hi.
My issue is I'm a recovered drug addict. I'm a practicing alcoholic. And since I've got out of jail, I've gone back to school, and now I'm a nurse.
Oh,
But I have not had one day of abstinence in 9 years.
Okay.
Did you have a question, Sonia?
Pardon?
Go ahead. Did you have a question?
I was sick with the flu a week ago. Like, this was my first week back to work, Monday till now. I did my first week. And all I did was lay there, sicker than sick, and drink. And I'm really afraid that my retirement is going to look like that.
Are you saying that you need some help with your drinking?
My drinking, yeah. Well, I come home from work and I drink. On my days off, I do whatever I have to do, then I drink.
Yep.
I'm a functional alcoholic.
Yeah, yeah. It sounds like it. You know, there is actually, Sonia, I don't know if you're aware of it, but there is actually a healthcare professional program. It's called the PHP, the Professional Healthcare Program, for people who are in the healthcare system who are wanting help with their addictions. Are you aware of that, or have you tried to find out about that?
We have an EAP program.
Yeah. No, this is
through Homewood, and I called them.
Yes.
I'm kind of thinking I want it faster than what they can do.
No, I'm not. Yeah, I understand that, because you could wait forever there. You could wait 10 months or something. I mean, I don't know. I know waiting lists are really long. If you're thinking of something residential, a place like Renaissance doesn't take that long. It's 1 or 2 months. But even aside from that, if you call the OMA, the Ontario Medical Association, and ask for the PHP program, they'll hook you up with somebody, and they have nurses and doctors that go into groups. They're kind of their own little groups. They're facilitated by another physician, an addictions doctor, and they're exactly for people who are in your situation who want to stop. And it sounds to me like you're at that place where you don't want to live the way you're living. Am I right about that?
Not. Yeah, you're right.
Yeah, so
Not.
there's help for you. There's help in the general system, like through a place like Renaissance, or, like I said, with this PHP program. And you can get into one of those. You can speak to an addictions counselor as part of this tomorrow if you call. Like, it's pretty quick, especially if they know that you're working in the system, because they want to protect the system and they want to protect you. Yeah. I mean, I'm worried about that too. Like, you know, you could be making mistakes, and I mean, you're in a pretty dicey situation, but you're asking for help, and there is help there. Yeah.
Donna, did you have anything to add?
Sounds like you're ready to make a change, Sonia. So all the, take the next step.
Yeah. So PHP program.
PHP program. Yeah, you call the OMA and ask for the PHP program, and then they'll hook you up with somebody, and then you can get that process started. Yeah, and also, like I said, Renaissance. And if you can wait longer, I know that Homewood and Bellwoods, I think, have a medical they have some kind of health care program as well. Although I do think it takes a while to get in. Yeah.
So some resources for you, Sonia, and I'm so glad that you called into the show tonight. That is excellent.
Yeah.
Thank you so much. I'm glad you're watching, and so I hope that was helpful. We're going to take another short break here on Living Clean, Living Well, but when we come back, more of your phone calls and more from Dr. Tarman and Donna Sadler. We'll be right back.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers. But they put me into counseling and everything here after my detox, which was the smartest thing I could have ever done. I got the real demons out of me that I wasn't able to do over the last 10 years with all those other detoxes, all those other treatment centers, from private ones to government ones. And this place has actually given me my life back.
Hello, I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Welcome back to Living Clean, Living Well. Our panelists have been giving us some great resources tonight, and I hope that you folks have been able to jot them down if perhaps it pertains to you. Another great resource is Recovery Wire magazine, and you can get your free copy online if you go online and request it. Their latest issue is out. Dr. Tarman writes for them. Are you in this one?
I am.
Yeah, what did you write about this time?
Oh my gosh, what did I write about this time?
The Wounded Healer?
Yes, that's
you?
right.
That's you.
Yeah, that's me. That's right. Yes, that's right.
And you write about the people in the healthcare profession.
Yeah, and whether they should self-disclose to their clients or about their own addiction.
Oh, there you go.
Because it's an interesting dilemma, you know, because the healthcare professional perspective is keep your own story private so that it doesn't interfere with the patients. But in the general recovery world, often they want people who are in the field, or pardon me, have had their own experience, and they want that disclosure. So it's an interesting kind of tension. Yeah.
That is. Well, let's go back to our phone lines now. We're talking tonight about trauma and addiction, but we're also taking your general questions about addictions and substance abuse as well. Let's go back to the phone lines, and holding patiently from London, Ontario, on line 1 is Arnold. Hi, Arnold. You're on with Dr. Vera Tarman and Donna Sadler tonight. Go ahead.
Yeah, hi. I just want to make a comment about my trauma that I went through.
Sure.
I'm an alcoholic, and this past February I celebrated 24 years of sobriety.
Congratulations.
Thank you. And I'm also an addictions counselor. When I came out of treatment the last time, I went to school and took a 2-year drug and alcohol course and got hired immediately upon graduation. And I went through some heavy training with noted therapists. They wanted to make sure all the staff counselors got their junk out prior to bringing clients on program. And we had counselors from Round Lake Treatment Center, Poundmaker Lodge in Alberta, Native Horizons. We had a guy from Oregon and a noted therapist, Jane Milton Moss, and they worked with us. And I was never sexually abused or anything, or physically abused, but I became an abuser, and that was on my mind all the time. And when I started doing the work, these counselors, they said, "That's not your issue, Arnold. Your main issue is abandonment." And my mother left me when I was 5, 6 years old, and I never saw her for 16 years. And they said, that's what you have to work on, the abandonment issue, the abandonment trauma. And I said, no, I don't. My mother's been dead for 7 years, and I'm working on accepting the fact that she was never there for me. So I went through what they suggested I go through, some inner child work with them, and I couldn't believe the anger, the emotional anger that I had towards my mother. I was calling her in this role play that we went through every dirty name in the book. I was swearing at her. I was, why'd you leave me? Why'd you leave my dad? And on and on and on. And when they got out, this therapist got as much anger out as she could. She put her arm around me and she goes, son, I love you. Please forgive me. I get really emotional just thinking about it. And,
really.
And that broke me. And the rest of the staff were there for support. And when I got through crying, I asked one of the staff, I said, how long did I cry for? They said, geez, Arnold, you cried for about 20 minutes. And, that got, I can honestly say today, I love my mother. I talk to my mother and my dad all the time. And they've both been dead for a number of years. And also, too, because I had an abandonment issue, I used power and control over people, over my ex-wife and other girlfriends, and that never got me anywhere. I have a girlfriend today that's been 12, 13 years, and she tells people, Arnold doesn't use any power and control methods at all over me. He doesn't ask me who was on the phone or who was I talking to or who's this or who's that. I get rid of the power and control. I get peace, happiness, joy in my life. I go to bed at a certain time and I'm asleep in 5 minutes. I sleep through the whole 8 hours. My mind isn't going 100 miles an hour like it was prior to going into treatment the last time. And I don't feel like I'm going crazy.
Arnold, do you think that experience that you had was the key thing that made the change for you? That experience with the counselor where they did that role play?
What was what?
Do you think that experience that you just described, do you think that was the thing that made the difference for you?
Oh, definitely. It could be, definitely. That was the one that got all the emotion. Because they told me that I had a ton of anger inside me. And I said, no, I don't. But they continued insisting that I've got a ton of anger that buries all the other emotions. And once that anger came out towards my mother, hey, I can cry at the drop of a hat right now.
And is that the kind of work that you were able to do with your clients at the treatment center?
Absolutely.
Yeah. I think that's the kind of work that some of our callers would like to actually have.
Well, I'd be willing to help any way I could.
Yeah.
You know, it's great that you're sharing your story, Arnold, because you know, it's good that you're able to share this so that other people might see themselves in you. And your great message of, I didn't think that I had a trauma issue. I discovered that I did. I went and dealt with it. And now I can sleep at night and have a good life.
Right.
You know, I'm wondering how many people out there right now are listening to this and perhaps connecting with Arnold's story.
Yeah. It's really a message of hope for a lot of people, Arnold.
Yes.
Thank you for sharing that.
That's awesome. Thank you very much, Arnold. You know, it's great when we get your phone calls in. You don't have to ask a question. You can call in with a message of hope to everyone that is out there. I always love to say it's a community of sharing. We are an open forum. It is a safe haven for you. So we're here. All you have to do is just give us a name. Doesn't even have to be your name if you don't want it to be. Just as long as you answer when I call for you. So you could maybe give your middle name. So we do respect boundaries, and we do respect anonymity, and we really respect your stories, your insight, your journeys of recovery. It's great because there's so many great messages in there for us all, isn't there?
It really is.
And it sort of goes along the line of what you were talking about and what you wrote about in this month's edition of Recovery Wire magazine, The Wounded Healer. So there's Arnold, who is an addictions counselor now.
Yeah.
And I'm sure he's able to share his story and connect. Would you agree?
Yeah, I would think so. Yeah, that's right. I mean, what do you think about that, Donna? Like, do you think that the healer should tell their story? Because it's a hard one in the workplace.
It really is, and there's some places that encourage it or don't discourage it anyway, and then there's other places, of course, that don't allow it. But I think that as long as it's not the therapy session is not about me, then there's nothing wrong with it, and it can probably even be helpful because you know, I mean, if a person sees another person who's in a role of a leadership and helping. And hears that, you know, I wasn't always here. This wasn't always the place I was at. I was at a very different place, you know, before. And, you know, it's not about taking away from what they're talking about. It's more about, you know, normalizing the playing field. It could happen to anybody. And it does.
That's right. It absolutely does.
You know?
And I mean, like I work at Renaissance, and they have a strict policy. It's a sort of understood policy that the people who are working in the field and the front lines have their own history, but they have to be in recovery. They can't be actually actively using, and if they are, then they're asked to leave.
But they'll be allowed to share their story.
They're encouraged to share their story. Yeah. So and Donna's right. Some places, some places really foster that, like Renaissance, and other places say no, we have to keep it separate because we don't want it to be about me. It's about you. Yeah. It's really interesting how that works.
Yeah, how apropos that you wrote about it this past month in Recovery Wire magazine. Let's head now to our phone lines again. Let's go to line 2, and Dave's calling in tonight from Midland. Hi there, Dave, a longtime friend of Living Clean, Living Well. It's great to have you back on the show.
Yeah, hello, Teresa.
Hi there, Dave.
Even I know you now, Dave. Hi.
You were mentioning the RAP program.
Yeah.
It stands for Wellness Recovery Action Plan.
Oh,
awesome. Wellness Recovery Action Plan.
I can give you a little bit of insight on it.
Sure, Dave, go.
It was developed by Mary Ellen Copeland and a group of friends who had all experienced the mental health system. She's from Vermont. And RAP includes a daily maintenance plan, triggers and action plan, early warning signs and action plan, when things have gotten much worse in an action plan, crisis planning, post-crisis planning. RAP group members explore specific issues that affect wellness, such as changing negative thoughts to positive ones, building self-esteem. Mary Ellen Copeland sums up RAP with these words: for a person who has been in the system a long time, RAP is often a person's first introduction to the idea that their own ideas and views have value, that they can make their own decisions and move on with their recovery.
That's great, Dave. Thank you so much for that. A great resource. Donna, you were aware of them, right?
Yes, I have heard very much about the RAP program.
And accessible to us in Canada?
Yeah. It's Women's
College. And it's in Toronto, Women's College.
Women's College, yes.
That's great. Is RAP available to you in the Midland area, Dave?
It has been, and actually it can be, and my wife facilitates it.
Wow.
I've taken it. There's a number of us. I work as a peer support worker, and there's a number of us peer support workers that can facilitate a group.
So it's not just, is it like Toronto based and then it's got satellites, or is it people still have to come into Toronto?
No, it's in our area. I think we're going to be starting one at the outpatient.
Wow.
That's good to know.
I took it I took it actually in Penetang at the hospital. It just depends on whenever they set it up. It's not an ongoing thing.
I see. Yeah.
That's great, Dave. Thank you so much. I really appreciate that.
Yeah.
So from one of our longtime viewers and watchers, it's great to get that information. So that's Dave from Midland. Let's go now to line 4. Pat's calling tonight from Edson. Hi there, Pat. You're live on Living Clean, Living Well with Dr. Tarman and Donna Sadler. Go ahead.
Hello, can you hear me all right?
We sure can, Pat. Go ahead, hon.
Thank you, thank you. Good evening, ladies. I have been watching this program probably for 8 or 9 years.
Wow.
Right after my AA meeting when I get home.
That's
my
great.
husband and I watch it religiously. And I would like to comment. I don't really have a question on trauma this evening, but I would like to comment on the information that you put out there that helps so many, many people. It is amazing what you can learn from the information on this program, how many people it has helped. And I would personally like to thank Dr. Vera for sharing the fact that she used to be a smoker.
Oh.
I myself smoked for over 50 years, and Dr. Vera, when you revealed and shared that you sucked on a baby pacifier.
Oh my God, you remember that.
Time to time, I bought a pacifier, and I have been smoke-free for 6 months.
All right, good for you. Yay. That's great. I'm a little embarrassed about that story, but I'm glad it helped you.
I remember that night that you shared that with us, and I went, good on you, Dr. Tarman, because, you know, all of a sudden, it's sort of, you're such a valuable resource because you're a doctor, but then we see the human side of you, and you're just like the rest of us,
That's right? My secret thing, I have a baby pacifier.
Pat, she's blushing a bit.
Yes.
But you know what? It works, and it helped Pat.
Yeah, that's right.
Yeah. Hey, Pat, you've just really given us a lift here tonight.
Thank you.
Yeah.
Thank you, Pat.
Thank you so much for watching. Thank you for continuing to watch all these years. This show is very near and dear to my heart, and I love the input that we have from our wonderful guests. And I'm so glad that you and your husband and others are finding it a great resource. So thank you so much for calling in tonight. And I've never seen Dr. Tarman blush before, but she just did tonight on Living Clean, Living Well.
Great. Thank you.
And you know, it's so good to be able to smile too. It's okay, you know, when we're going through these things in life, it's okay to bring a little levity to the situation. It's you know, it's life, right? The big roller coaster, the highs and then the lows, and you think you can't go any lower, and then we do, and we come back up again, and we're feeling pretty good. And you know, sometimes it's just nice to smile and laugh a bit, right?
Yes, it certainly is. Yeah.
So thank you for that tonight. Let's go now to line 6, and Alex is calling in from Bowmanville. Hi there, Alex. You're live on the line with Dr. Tarman and Donna Sadler tonight. Have you got a question for us, or perhaps maybe a comment?
Just some guidance. I have recently gotten myself out of an abusive relationship, and with a very active meth user. I'm very active in crystal meth as well.
Oh boy.
I'm 7 weeks pregnant as well, and I do plan on terminating the pregnancy, unfortunately. I'm just looking for some guidance tonight. I'm having a rough night.
Oh, Alex.
Wow.
Absolutely. I'm glad that you've reached out. Dr. Tarman, would you like to begin?
Well, crystal meth is such a devastating addiction. I thank you for calling in and asking for help.
Yeah.
There is help. The first thing I think of is to find a detox. And I mean, do you want to get clean? I guess that's the first question.
I do, actually, believe it or not.
Yeah.
My main goal, and before I went back out into the world of using and stuff, I was actually, you know, making the right moves to get into CAMH and to be in Pinewood and to you know, do the things that they say, right?
Yeah.
And I don't know what hit me, but something hit me, and I just up and left, and I left my home with my family and my
right,
and moved in with this guy who just didn't know how to be in a relationship because all he was focused on was the party.
Yeah.
The party's over for me, so.
Well, if the party's over for you, are you prepared to leave the situation, like the house that you're living in, the relationship that you're in? It's
Yes,
pretty
I've
hard to
actually-
stay clean when you're still living with an active addict.
Yes, I realized that, and I lived through one weekend with an active addict, and I was hiding in the other room, you know, and I finally was allowed to come back home into my parents' house. I'm 22 years old, by the way.
Okay, okay. Well, you know, the first thing I think of, where do you live now? You live in Bowmanville. Okay. I don't know what it's like in Bowmanville, but the first thing I think about is Toronto, like there's women's own detox?
At Pinewoods in Oshawa, actually, and then they have some satellites in Bowmanville, and I think maybe in Bowmanville, but in Whitby. But you mentioned, Alex, you mentioned Pinewoods, right?
With the Umbrellas program, I'm not sure if I'm on a waiting list for treatment or not, but...
Yeah. So yeah, they have that there.
A rough night, the transition back home, and I'm being on Mother's Day as well. Of all just having a very rough night, and everybody in my house is sleeping, of course, and I had to change my number tonight.
Of course you do, yeah.
Yeah, I had to change my number. It got that bad. He was contacting me from every which number, every which way that he could think of, he contacted
me. I mean, you know, like I said, this is a very devastating addiction, crystal meth, and you're going to have to put all your stops out. And one of those is, you know, people, places, things. You've got to stop seeing the people, get rid of your phone numbers. Like, you're going to have to do all of those drastic things. And I don't know if I mean, it's good that you've left the environment. It sounds like you're at your family's home. But, you know, if you were in a detox or something where there's a little bit more safety, so that you can't in the middle of the night slip out and get into trouble again, that would be better for you. And there's places like Homestead, for example, or other treatment centers that will help if you reach out. And I would suggest that you start doing that tomorrow, so that just so you don't have to keep waiting. I don't know, Donna, if you have more to add.
Alex, I just think it's great that you're kind of feeling a little shaky tonight, and you called into the show, and it sounds like, you know, you're really determined, and you're trying to, you know, put a good effort into staying clean, and I applaud that. And you know, so there may be other nights like this where you're not so sure, and you're having a rough night, and so I think that maybe during the day when you're not feeling like that, it might be a good time to think of some things like calling into this show that you can do to keep yourself safe and keep yourself at home.
And the other thing I would suggest is get on the internet right now. Like after this show is over, look up CA or look up NA. Just get people in your court that want you sober. You want to have as many people in your court that are sober, because the pull to want to go slip back it's inevitable with early addiction. And the more people you have to call to say, look, I'm having a rough night like you did tonight, the more you're going to be able to get through each day, one day at a time.
Alex, I really have to go to a commercial break, but I don't want to leave you until you have everything that you need. What Dr. Tarman had to say and what Donna Sadler had to say, does that help? Do you need anything more from us?
No, it helps. It definitely helps. Every little bit helps, right? I just called in to get my story out there.
Yeah.
And just to have somebody else hear it, you know, other than my therapist and my doctors and my family, you know, they're all sick of hearing it, right? Well, they're not sick of hearing it, obviously, but they're...
But you're asking for help, you know, and asking for help is the first step in recovery.
Absolutely.
Very brave.
Absolutely. And, you know, Alex, we don't know you, but we can hear you, and we care. I think we care about everybody that calls into this show, and so we care about you tonight. And if you need any more help, please call the Canadian Centre for Abuse Awareness. They also might have some resources for you. But I think everyone and the resources that Dr. Tarman and Donna have said tonight will help you. And, you know, I find too, in the dark of night, when it's...
Oh, that's when it's really hard.
It just sometimes, I am so overwhelmed sometimes with life, and everything falls in on you. And sometimes I just say, go to bed, get some sleep, and you'll get up in the next morning and you'll feel a bit stronger. And you know what, Alex? I do. And it just sometimes, just allow yourself to rest, and to know that tomorrow you can reach out to those resources. I'm so glad that you reached out to us tonight. Please keep watching, call back in, let us know how you're doing, okay? Thanks for calling. We're going to take another break here on Living Clean, Living Well. And when we come back, more of your phone calls.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Hello, I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
Welcome back, everybody, to Living Clean, Living Well. We continue to take phone calls here as our time with you is winding down for the week, but we're going to get these ones on. So let's go line 4, and Andre's been holding patiently from Quebec. Go ahead, Andre. You're on live with Dr. Tarman and Donna Sadler.
And, well, hi, all of you. How are you?
Hello, doing well.
Okay, so I work with somebody here, and I want your opinion on this. So basically, do you think it's true that all the people that seem the happiest are actually the people that are the loneliest inside?
Did you hear him properly?
I didn't hear the first part.
Andre, could you just repeat that just a little bit slower for us? Are the people?
The people that seem the happiest from the outside, do you think it's true that they're the loneliest from the inside?
Ah, the people that seem the happiest on the outside, do you think they're perhaps the loneliest on the inside? That's an interesting question. I would think that, I would say a lot of us sometimes put up the facades as we carry on and do our everyday work, and we don't want to burden the world with our problems, and we just do the best that we can. Are they the absolute loneliest? Your thoughts, Dr. Tarman?
Well, what I'd like to say about that is I think that a lot of us are lonely and lonelier than we like to show that we are. I mean, I think that loneliness is a feeling that many of us struggle with, and whether we're happy on the outside or not is just an individual variation. No, I don't think that people who look the happiest are the loneliest, but I don't think it matters if the person looks happy about how lonely they are or not.
I think that very often we can't tell what's really going on in a person's life by how they appear to be, how we perceive them to be. So a person that looks very happy to me might not really be having such a good time, all the time. They might not. You don't know what goes on in people's lives, right? Or in their brains, I guess.
But one thing I can say is that I think that people who are suffering from addiction are probably amongst the loneliest people in the world, because it's a very lonely-making phenomena. Yeah.
Andre, how would you classify yourself?
Well, the reason I'm asking that is actually because I've had a lot of feedback of a lot of people telling me always I seem like I'm such a happy, smiley person, but down in the inside I feel like I'm kind of missing some sort of. I don't know if you know what I mean here.
You're missing something in life?
Lonely, right? I only have brothers, and I mean, not much going on really. And I mean, I'm not miserable, but I mean, I'm very not as happy as I could be, right?
Yeah.
Panelists, do you have anything to
Well, you know,
That's hard.
What I think about there is that when I'm feeling lonely, which, you know, it's interesting, you can be lonely even when you're, you know, in a crowded room or if you've got family and all that sort of stuff. And I find that for myself, I don't know if this will work for you, but I find that for myself that the best thing to do when I feel lonely is to find another lonely person and give something. Because often when I'm lonely, I'm very aware that I don't have a connection. It's really, it's a lack of connection. And if I sit there and wait for that connection, it's not going to happen. But if I reach out, I am so startled by how people want connection. And if I reach out, the hand comes back. And then I don't feel lonely anymore. So that would be my suggestion, is when you're feeling lonely, start a conversation with somebody and see if you can make a meaningful conversation, and it might help. That's what helps me.
Donna?
Yeah, I just like to, what Vera said, you know, try to reach out to somebody that you trust, that you want to connect with. You know, I think you said you have some brothers and stuff, right? Yeah, so maybe or think about like what you would like to be doing, or that would make you feel more connected or more happy, or, you know, what was it that you'd like to do that you're not doing?
Oh, working at the outside. I'm seeing the world pass before my eyes whenever I'm just working a desk job. I mean, yeah.
Oh, okay. So maybe more of that.
Yeah. Yeah, just making connections with people. It's, you know, and that's easier to say than do.
It sure is.
Yeah, because you got to put yourself out there.
Yeah, yeah. But that's what I'm saying. I'm always shocked when I put myself out there that people want it. And then I think about that song, you know, Eleanor Rigby, all the lonely people out there. They're out there, and they want connection. Even when they're grumpy and they look like they don't want to talk to people, it's like you make that effort, and it's like, oh, it just melts that grump.
Yeah,
you know,
and it's almost like taking that one baby step.
Yes.
In anything.
Yes.
Not only towards happiness, but also like towards recovery and all the rest. It's so important to take that first initial step, isn't it, Donna?
And it's hard to, because you want the person to come to you, but they often don't because they're stuck in their own prison.
Every journey begins with a single step.
Yeah, it does at that. We're going to take our final break here on Living Clean, Living Well. But when we come back, final thoughts from my panelists tonight. We'll see you in a moment.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers. But they put me into counseling and everything here after my detox, which was the smartest thing I could have ever done. I got the real demons out of me that I wasn't able to do over the last 10 years with all those other detoxes, all those other treatment centers, from private ones to government ones. And this place has actually given me my life back.
Welcome back. Tonight it has been an interesting show of sharing, of special insights, lots of resources, and of course, as always, some great phone calls from you. Final thoughts, Dr. Tarman.
Well, just thank you so much for making the calls, the callers, because it is a way of reaching out, and other people are listening, and it's a way of us all recognizing that we all feel the same. We all have that loneliness, and when you make that call out, another person feels that connection. So thank you.
Donna?
I'd just like to say to everybody, you know, hang in there, keep trying. If you are struggling with something, there is something to help you or someone to help you. So reach out, talk to somebody. There's hope. There's always hope.
That's wonderful. So thank you so much, folks, for joining us once again on this edition of Living Clean, Living Well. It is a show that all of us who are involved with are very proud of. And when we get phone calls like Pat from Edson tonight and the rest of you that have emailed us or calling us, and even if there's something you'd like changed, we'd like to hear that too. So look us up on Facebook, Living Clean, Living Well. Big thanks to Dr. Tarman. Thank you, Donna Sadler. We'll see you next week.
Living Clean, Living Well has been brought to you by freedom from addiction, and is a presentation of the Canadian Centre for Abuse Awareness.